Hi, my name is Dr. Amber Valentino, and I'm the Chief Clinical Officer at Trumpet Behavioral Health. We hope that you and your family remain safe and healthy during this time. We remain very dedicated to supporting you and your family through these challenging times. We've gotten a lot of questions from our families about our services and how they can best navigate the current situation. And they also want to know how we as an organization are responding to the COVID-19 crisis. So today I'm hoping to answer some of those most frequently asked questions and provide you with some additional support and information to get you through this. So the first question that was posed to us is, are virtual sessions, or as people often refer to them as telehealth, being conducted? And if so, what are the benefits of doing telehealth? And importantly, should our family be doing it? So the answer is that when funding sources permit, which they often do right now, we are utilizing telehealth, and those sessions are delivered online. They are conducted in a variety of ways. So the important thing to know is that telehealth is a way to provide services that allows for consultation and sometimes even direct therapy to be delivered remotely. It could involve something like parent training, parent education, which as a parent would walk you through a structured curriculum to talk to you about how to manage your child's behavior and to teach him or her new things. Could also involve coaching you through how to actually implement a behavior intervention plan or a teaching session with your child. And telehealth sessions also could actually involve directly working with your child. So this could be in the form of a social skills group. We've gotten kids together for groups before that can navigate their computer screen and interact with the chat feature and with audio. And so there are some children who can receive direct therapy through telehealth. So, to participate in those sessions, you really just need an internet connection, and our clinicians will walk you through how to prepare the environment and how to get the most out of that session while you're using that remote platform. So, great question. There's a lot going on there. We're excited that people are so interested in utilizing telehealth. There's a couple additional questions about telehealth that I'll answer. The first is, who can conduct virtual therapy sessions? Typically, in this case, it's the BCBA, but a registered behavior tech or an RBT can conduct telehealth in some situations. And the final question is just, why should we do telehealth? Why is it important? What's in it for us? And there's a lot of reasons. The first being just some continuity of care. So we want to make sure you don't go from receiving a lot of therapy and intervention to nothing. And telehealth can really support you and your family, provide that bridge, provide that ongoing support. And importantly, make sure that your child doesn't regress during this time, either with skills lost or increases in problem behavior. So we want to attend to that, and we really think telehealth is an opportunity when direct services are not an option to make sure that those things don't happen. Okay, so the next question is, when will Trumpet centers be reopened? So we are continuing to monitor, as I believe most people are, the CDC and local health authority guidance. And at present, our center locations do remain closed, except for limited services being provided, a small number of clients, and that's really based on clients' needs. So we just continue to evaluate every day. Our leadership team meets and we evaluate the new information and assess when it would be appropriate and safe to open up our centers. We are on an ongoing basis developing additional health and safety guidelines to make sure that when we do reopen our centers, that it's the safest environment for our families and our team members. And so we'll just continue sharing those center openings on a location by location basis in the upcoming weeks. Okay, so the next question is, what health and safety measures has Trumpet implemented during this time? So we are continuing to take steps to monitor and protect our health, both the health of our team members and our clients. And so we have a health screening policy, and that policy includes a in-depth health screening questionnaire and ask questions about symptoms, travel, all of the things that we would want to know to assess whether a person is feeling healthy enough to conduct sessions or to participate in sessions. We also have a hand washing and face covering recommendation and requirement. This is new based on some information that's come out. Again, making sure that we protect our team members and our clients. So that health screening occurs at every session, and if all of the questions are answered with a no, meaning I don't have symptoms and haven't traveled, et cetera, then we proceed with the session. But if we answer yes, then we stop and we don't proceed, and we make plans based on the answers to those questions for resuming services or making sure that everybody is healthy and safe before that can occur. Okay, so our next question is Trumpet providing direct services in client's home? And what should our family be considering if we should continue with our restart in-person therapy sessions? So we are a medically necessary essential services that's been defined by the federal government and the states in which we are a provider. And so we do have an obligation to support our clients' needs, and we have continued to provide services directly when we can do so in line with our own and the CDC's recommendations for health and safety precautions. So your family, of course, needs to feel comfortable with that. And we have our health screening policy. We have our hand washing procedures and mask wearing. But we want to acknowledge that there is some risk there. And so this is something that's a very personal decision for you and your family about what you feel comfortable doing. And we are only proceeding when everybody feels comfortable, both the team member and the family. We want to consider that along with the impact that not receiving services may have. So we've heard from a lot of families who are feeling um, very stressed out and feeling like that structure has gone away and they're not sure what to do. So when it is safe and when everybody is healthy, we want to make sure that you are feeling that support from us. And don't feel overwhelmed by trying to make sure your child doesn't regress or increase in problem behavior. Okay, so just a couple more questions. The next is, what is Trumpet doing to help support employees during this time? We continue to make investments in the health and safety of our team members. We care about our team members quite a bit. So in addition to our comprehensive health screening policy, we're developing additional resources. Our HR team has continued to support teams who've lost income due to the impact of COVID-19. We are assessing application for and access to numerous government assistance programs. We're also providing reimbursement for personal purchases, for protective equipment like face coverings, etc. When we have team members who are benefit eligible, we've kept all of them eligible for their existing benefits by waiving the previous eligibility requirements and providing financial assistance when we needed to retain access to those benefits. So important in terms of the benefit accessing for our teams. And we just continue to operate and identify opportunities for support. So as I mentioned, we meet as a leadership team every day, and there's not a day that doesn't go by where we don't talk about what we can do, what assistance we can offer, and how we can help our very, very valuable team members get through this situation. Okay, last questions. What does Trumpet plan to do going forward to address the COVID-19 impact on the team members, clients, and the organization? So we understand that we're living in a unique world right now, and that this situation is going to permanently change our service delivery. It's going to impact us, our clients, and our communities. And so our leaders are evaluating that daily operational safety and clinical programs that we need to implement in that new world. And so that is changing daily, and we're always thinking about, what next and what's going to happen next and what do we need. I think the important thing for us is that we really remain completely dedicated to our mission, maximizing the potential of those clients that we serve. And we're continuing, even with all the changes, to be honored by the opportunity to serve your family. So we hope you found this video helpful. Hopefully that you are staying safe and healthy. We will keep you updated and informed as the environment evolves. Your local clinical team is always a resource for you. We love hearing from you, so we're here to support you and your family. You can email us directly, very simply at contactus@tbh.com. That's contactus@tbh.com. No capital letters, no special characters. Thank you so much for always putting your partnership to us and for the opportunity to serve your family. Stay healthy and safe. Take care.